Well, the Democratic Republic of Congo is struggling in its fight to control an Ebola outbreak. Africa 54 health correspondent Lino Madu joins us now with the latest details. Lino.
The Democratic Republic of Congo has recorded the first death from Ebola in the eastern trading hub of Butembo, a city of nearly 1 million people. The Ebola epidemic is believed to have killed 85 people since July and infected another 39. Most have been in villages, but about 20 cases have been in Beni, a city of several 100,000 people with close links to Uganda. Health officials say they are making progress in slowing the virus's spread with experimental vaccines and treatments. But they cannot be sure the situation is under control due to difficulties accessing some areas. For more insight on the Ebola epidemic in the DRC, joining us live via Skype from Walkersville, Maryland, in the eastern U.S., is Dr. Malonga Myatudila. He is Senior Public Health Specialist and International Consultant. Dr. Myatudila was part of the team who first discovered the Ebola virus in the Democratic Republic of Congo. Dr. Malonga, it is good to have you back on Africa 54.
Thank you for having me again.
You are working closely with health authorities in North Kivu province. What are they telling you in terms of the latest developments?
As of yesterday, the number of cases has been, the total number is 127. Out of them, 96 confirmed, meaning that they could do a biological test to make sure that it's Ebola. And then 87 people have died from Ebola, 56 of them confirmed cases of Ebola.
Okay, and these are numbers coming straight from health authorities on the ground. Now, let's talk about this. The country has gone through several Ebola outbreaks. What is particular about this outbreak, given that it seems to take longer to contain?
This is the 10th outbreak since 1976. Now, the North Kivu is currently in a very special situation. As you know, this is the region where you have coltan, meaning that we have a lot of armed groups that are trying to make it easy for other people to get access to that mineral. Because of that, it's very difficult from the central government, even from the provincial government, to have a control on all the health zones. So that is making the control a little bit difficult. As you know, the first cases were diagnosed in May. You can see how long it took the central government, even the provincial government, to start fighting against Ebola. So this is the first time that we have that kind of delay because of the situation, as I explained, that it's a conflict.
Yeah. So quickly, before we wrap, what are some of the strategies then, given that there are rebel groups in this area? What are they doing to be able to access the population?
They are trying to go through the same recipe that was developed a long time ago, meaning to put the communities in the driver's seat. But because of the suspicion among groups, it has taken longer than usual to come to that strategy. But now I think they've made some good strides. For the time being, the resistance, the community level is decreasing. So this is why now they can say that they are starting to get control on the
situation. Okay, Dr. Malonga, we have to leave it there. Thank you so much for joining us today.
Thank you.
And that was Dr. Malonga Myatudila. He is Senior Public Health Specialist and International Consultant.